So, good morning. No, good afternoon. So, ladies and gentlemen, I'm a dermatologist from Taiwan, and I practice in my own clinic. Why I chose to buy this device in a normal dermatology practice is that this laser is a must in treating vascular lesions. So there are many vascular lesions that we encounter in a regular dermatological setting, like the port wine stain, poikiloderma, hemangioma, pyogenic granuloma, rosacea, and red acne scar. So rosacea and red acne scar are common in the Asian market. I believe it is in India. So using the I would like to talk about the basic laser 101, understand why 585 will work for vascular lesions. Why these aesthetic lasers work? Because of the theory of selective photothermolysis. I'm going to talk about the wavelength, the energy, and the target. It has full peak absorption at 585, and it's obvious to choose a laser at these two wavelengths. The lasers at these wavelengths are dye and are 585. So some of you might wonder which wavelength is better. The answer is inconclusive, but there was one paper that said that 585 is slightly more effective. So the laser that I'm introducing today is the 585 yellow laser. Then we'll have to talk about the energy and the pulse duration to be used for treatment. Because energy correlates with pulse duration, we must know the thermal relaxation time for a vessel in order to determine the pulse duration for the treatment. A vessel of 200 micron has a thermal relaxation time of 16.7 microsecond. At 300 micron is 37.5. So if we look at another table, the most common vessel diameters that are relevant clinically for rosacea, melasma, and red acne scar, that's the post-inflammatory erythema, is approximately 10 to 300 micron. The number is slightly different, but it is still in the 10 to 100 millisecond range. So if we cross-reference to the laser that are able to deliver such pulse duration, we got argon laser, dye, copper, vapor, crypto, and all these long lists that I have not seen commonly commercialized that I can get our hands on. The only relevant one is the pulse dye laser. So I don't know how many of you have a pulse dye laser in your practice, but I don't personally want to invest in a pulse dye laser because it's very expensive, with the dye being the consumable. And replacing it annually is very expensive and troublesome. Before 585, I was actually very hesitant in investing in a pulse dye laser. So that was the reason why I purchased the 585 the first the first year it was launched. And so this is what the 585 looks like. It's small, portable, but to ensure patient comfort, we need a Zimmer. So the initial benefit of purchasing a small laser is gone, because now we have to put the 585 on top of a Zimmer. A Zimmer is quite large. So it actually looks like a big laser now if you put it on top of the Zimmer. And if you were to look at the specs of the laser, you might find the laser is only 5 volts. This makes the 585 seems like a tiny little toy. But I have to tell you that it's still sufficient because of the design. The 5 volt energy concentrate at 1 millimeter diameter spot to produce an energy of 15.9 joules per centimeter at 25 millisecond pulse duration. When the pulse duration gets longer at 30 millisecond, the energy increases to 19.1 joules. So which with a scanner, you are able to treat a large surface area with enough energy to zap off the vessels. So it is very sufficient. And there are several handpieces that come with a laser. I don't use the pen-like handpieces anymore because I find the scanner much easier to use and with more clinical applicability. We often treat a large area on the face. So what we do in our clinic is that we treat our cheeks right here and on both sides of the cheeks, or for rosacea. So it usually happens on the cheeks. So having the scanner, we will be able to treat large surface area within a very limited amount of time. So the scanner is about 18 millimeter by 18 millimeter. The energy is fractionated for 1 millimeter dots. The number of dots to be shot can be adjusted using the pitch. What is the pitch? The pitch is the distance between each dot. So if we have a 1.5 pitch, that means between the center of each dot is 1.5 millimeter. So when we adjust the pitch to be 1.0, that means there is 1 millimeter between each dot. This actually means that there is no space when we adjust the pitch to 1.0, that means the circles are adjacent to each other. Because I know most of your clientele are probably Indians, and you certainly have a darker skin type compared with the Taiwanese. Using a pitch closer to 1.5 is very dangerous. So I would keep the pitch at 1.5, which is the maximum pitch that the device can adjust. So I wouldn't play around with the pitch, or you're gonna produce blisters and produce PIH. Okay, so next page is the scanner is you're able to customize the shape of the emission. So it's especially valuable if I want to shoot at a specific vessel or small focal area. So if I want to zap a vessel on my lateral cheek, I can use a small rectangular shape to zap it double time or triple time to see slight coagulation of the blood vessels to see results. And the way the scanner emits laser is through a randomized fashion. So there is no overlapping of the tissue. And the energy delivered is uniform. And furthermore, the treatment can be done within 5 minutes. So if I were to treat the PIE on the cheeks, I can produce the entire procedure. I can finish the entire procedure within 5 minutes. So here are some of my cases. I can show some of you. The first case, I treat 585 mainly with the red acne scar. So these are some of the common cases that we see every day in our clinical setting. This kind of red acne scar can persist on the face for more than half a year, and patients are usually very troubled by it, especially the ones that you see on this patient's cheeks. If we were to use the IPLs, and the efficacy with the IPL is, I would consider that is lower compared with the 585. But now, since I have the 585, I usually find good results for red acne scars after only 3 sessions. Another key for successful treatment is that patients should be free of acne. So I usually put my patients on Roaccutane and do my 585. This is the VisiEye red map. You see a good resolution of red acne scars. Here's another case. The erythema axis change is much more intense in this patient, and this usually results from very nodulous cystic acne And interest and intensity like this will probably take more than 1 year for this to be resolved by itself. But we can improve it within 3 months, and the patient's going to be happy. And look here on the after photo, you see new pimples popping up. So acne control is a must in order to successfully use this device to treat the patient. This is one of my most severe red acne scar case of the year. She came in very depressed because of the severity of her PIE, and which caused very intensive red discoloration on her face. And this is only after 4 sessions, so this means only after 4 months, the red acne scar improved significantly. On the other side of her face, and this is the viscia. Okay. And here's another case of red acne scar left after a course of Accutane. She had severe nodulocystic acne, which I controlled within 3 months. But once those nodulocystic acne disappear, patients usually complain about the PIE. She only had 3 sessions. So in a total of 6 months, you can solve a teenager's nightmare of both horrendous acne and PIE. And here is, okay, oops, go back. Okay. This is an example of red acne scar with dermatologic, and I treated him with Accutane and 585 for the pigmentation, and dermatologic, I treated him with topical ivermectin. So after 3 sessions, the pigmentation on his face and the erythematous changed in the pores and everything improved. So 585 by itself, it kind of you can use it in combination with what you have, or your oral medication and topical medication. It provides a very good complement for treating a patient holistically. And I just want to talk a little bit about this camera system I'm using right now. You can do a really nice before and after comparison with this camera system and produce real-time 3D imagery and rotate the patient. So you give this, you can show this to your patient, and the patient is going to be astounded by how high tech you are. Okay, and this is the red map. The imagery system provides a nice red map. So with the device like 585, you can use this camera system and then just switch it to another mode, and then you can see the vascular composition of a lot of the lesions. Okay, here's another case controlled with a 585. He's also controlled with Accutane, and I use the 585 to treat the redness on his skin. And once the acne and the redness is controlled, the skin looks totally different. Another case after 3 sessions, this is very severe PIE after acne. Another case after 3 sessions as well. Okay, acne rosacea is very difficult to control. Other than topical or oral medication, we can also use the right laser to decrease the vascular component of it. So look at this is also, okay. Look at the red patch on this patient. We see this very commonly in our daily practice. This patient actually has dermatologic as well, plus prolonged erythematous change on her face. So I treated her with topical ivermectin plus a 4 session of 585. And you see how the pores and the red map improved. Okay. Another case of pustular rosacea. I also treated her with topical ivermectin and 3 sessions of 585. The patient is very happy with this. The large vessels on that patient's lateral cheek diminished as well after 3 sessions, but okay, I rarely treat the individual vessels if you were to ask me, but even with the scanner that we use for this patient, okay, for this patient, you can see on the red map, it improved significantly after 3 sessions of using the scanner. I didn't zap the individual vessel specifically, but these specific vessels does diminish after several sessions. Another case of rosacea. Okay, so do you know that 585 can be also applied for melasma? Well, it can, because part of the pathogenesis of melasma is hypervascularity underneath the skin, and it causes the increase in vascularity causes hyperpigmentation on the skin. So if we were to treat the vessels, some of the melasma will go away. So right now, I routinely use the 585 before my picosecond laser if I see any signs of redness on my melasma patients. And this is also to prolong the resolution of melasma if I have successfully treated the melasma, say that with a picosecond laser or a Q-switch Nd:YAG. This is a concept of multi-layer treatment with different wavelengths. So 585 is adding another wavelength and another concept of treating the vessels and not the pigments. So this is a little case that shows possible correlation of melasma with the vasculature underneath. She didn't receive any picosecond laser. Instead, I used the 585 to treat her superficial vessels. And only after 3 sessions, not only did the redness improve, her melasma improved significantly as well. This patient just came back 2 weeks ago for a 6th session of 585. Her melasma just went away because this is only after three sessions, and on her 6th session, she didn't have any melasma. And this melasma looks like pigmentation is also due to the vessels. She simultaneously received Nd:YAG and the 585 for 3 sessions. There's a great improvement on the melasma, redness of the skin, and pigmentation. Another case of melasma due to underlying vascular component. There are 3, this is after 3 sessions. It is common to find that the majority of the melasma patient have an underlying vascular component. So it's obvious to incorporate some form of vascular laser to treat melasma. And it also works great on acne chilioidalis. The hypertrophic scars on the jawline is a common complaint if the patient has a history of severe nodulocystic acne. I usually treat it with the CO2 laser, then combine it with a couple of sessions of 585. The resolution is quite nice. And I know some of you want to ask me if 585 works well on port wine stain. It is not a replacement for pulse-dye laser. I've only one experience with a port wine stain, and it works fine. This is after 6 sessions, but I don't believe that it can replace the pulse-dye laser because it doesn't produce as high amount of energy, and it doesn't penetrate as deeply as the pulse-dye. So I believe that this is what it can do at most. So if you have patients like this, it's it's not a replacement for post dilation laser, but it does improve the port wine somewhat. And so in conclusion, this 585 laser is not very painful. It's very safe, and it has very little downtime. The downtime we're looking at is probably a couple of hours. The patient might complain a little swelling and a little erythematous after the treatment, but it will go away within hours. Okay, as you have shared the effect of 585 on red acne, does it give resurfacing effect as well? Okay, this is a non-ablative treatment, so it does not give resurfacing results. The thing that it does is it coagulates the small vessels within the epidermis. So this is what it does only. It treats only the red lesions. It doesn't give the resurfacing. You can go to a CO2, and what else? Erbium, picofractional. Okay. Have you had any experience with melasma treating on? No, I've only experienced with a skin type 3. So, I believe that because treating with the 585 is not very it's not pigment selective, so it's got to be safe with an Indian skin type. Okay, how about this? I'll show the 585 how it works on some. I'll show you some of the videos that I do. Okay, here it is.
红色的痘疤，血管性增生的缔造的一个东西。
Okay, this is how the 585 looks like. This is what the scanner looks like. And
半年、一年或者1年左右，就是如果说我们讲痘痘的话，通常会遗留下来很严重的痘疤的痘疤。
with the PIE, you will leave with a lot of red small vessels after a large nodular cystic acne. And with the 585 is that you can treat these vessels, these vessels very easily using the 585 wavelength. So you can zap these vessels, coagulate them within a short couple of sessions. And let me show you how it's done. And what I'm saying now is that the pitch that we use is 1.5, even for Asian Chinese skins that we have right now. And some of the patients do have a little scabbing if their skin is darker. Okay, this is how it works.
那个刚刚讲的那个 random mode， 就是它输出的时候，它就是会乱点输出。如果说没有调刚刚那个 random 的话，它就是会。
How it emits and you can shrink the emission to be very small. Okay. All right. Oh, what is the interval between each session? Any cases of PIH? Okay. What about the downtime? Downtime, first of all, there is no downtime unless there is scabbing that occurs, and I believe that with the scabbing is because the skin is too dark. There will be scabbing even with a 26 millisecond pulse duration. So I believe that with an Indian skin type, you would probably very likely have scabbing, but no incidence of PIH yet for our skin type. So yeah, you got to try it out for the Indian. Okay, for Indian skin type, the pitch distance is 1 millimeter give good results. Okay, I would never go with a 1 millimeter. You're gonna have blisters. Don't don't use 1 millimeter. Use 1.5 and do a double pass or even a triple pass. Okay, what about the interval between sessions? About 1 month?
To the conclusion.
So my conclusion is that okay. This device is great for PIE. It's very common in after acne, and I believe another application for this is that it works really well for vascular type melasma, and you know how difficult melasma can go. So another weapon is better than no weapon. Thank you. Okay.